Hello viewers, welcome to today's video, and today our daktari has something to tell us and we would like to know what he has for us today. Karibu daktari.
Eh, halo watazamaji, mimi ni Dr. Eric na leo ni fursa nzuri tena tumekutana kwa hii channel, na leo tunaenda kuongelea about anemia. Anemia ni there is a reduction in red blood cell circulating in the system, and this one can be identified by low hemoglobin and also reduced packed cells. For there is a group of people that we are going to talk about. This one are the adult male, adult female, children, babies about 3 months, and neonates. For male, we talk about their HB should be around 14 to 18 grams per deciliter. For females, we are talking about 12 to 16 grams per deciliter, and children from 11 to 14 grams per deciliter, and for babies around 3 months, we expect to be from 10 to 13. For the neonates, the baby who are born, we expect them to have a HB of 15 to 21. Above that is abnormal. So HB, when it is less than 13 grams per deciliter, you think of anemia. And for a chronic, maybe you are bleeding and acute blood loss, you can just get the symptoms when you have lost about 10 to 15% of the total volume of the blood. You start getting those symptoms. For a chronic, the blood loss should be 50% of the volume of the blood, and when you have a chronic anemia, your body gets to adapt, so you can survive with the HB of less than 13, and this one, because the body has adapted, there is an increase on cardiac output. Yani the heart pumps blood more faster, because it has adapted to the function. And the symptoms, patients come with the symptoms of tiredness, comes with the easy fatigability, headache. For you get that an adult, let's say the elderly, they come with there is a cardiac failure. This patient cannot see well. There is confusion, and also they complain with angina, the pain at the central thoracic. So they come with a sharp pain on the chest, and this one, if elderly come with this sharp pain on the chest, you first think of the cardiac failures, because people get to treat this patient of H. pylori, and they respond very well with the PPI, omeprazole as omeprazole. But you treat this condition, but the other one worsen. So you should get to check on these patients very well. On the signs, if you examine these patients, you get that there are the signs like the tachycardia, the heartbeats goes very faster. They tend to breathe faster. That one is tachypnea. You get the pallor, the conjunctiva. You get that these patients are pale, they are jaundiced, and the spleen also enlarges. So you find this one as the sign and symptoms when you are having these patients with anemia. And anemia comes with so many things. Like you get there is low production of this red blood cell. Maybe the patient is bleeding, and also there are defects in the maturity of red blood cells. That one is erythropoiesis. And then blood loss, you find that you get hemolysis. So you find that you lose so many blood, and also there is some of the of the infections like malaria zone. People who come from there, they you find that red blood cell hemolysis. So you find that they get this anemia, and also the infection like sickle cell. You get these people, they complain of vascular vaso-occlusion, that there is pain around the joints. When the blood passes, you find that they get pains like acute chest syndrome. They find so breathing comes more difficulty, and also spleen enlarges, and also there is a inability to concentration of urine. So these one are the symptoms you get a sickle cell patients complain of. And this one, you should get a proper history. You for this anemia, if you don't get a proper history, then you make your diagnosis to be difficult. So you must get physical examination, ethical origins like culture. Some people, they don't feed on blood, so they get anemic because of feeding on green vegetable alone. And also vital signs, you should check on BPs, blood pressure, and also pulse. You should check on that. For the hypotensions, these people, they get to maybe tachycardia and also tachypnea. So you find this one are the vital sign that you should check on these patients. And also, when you examine these patients, you get that they're having mamas on the left side. The left side, second intercostal pace, you can find that there is a mama. So you find a patient with this mama, you should at least check on the investigation. Like investigation number one, you send this patient for imaging, like you can check on them on the ECGs, echo, and also chest X-rays, just to make sure that you see the heart very well. Then you do full hemogram. Full hemogram, you should check on the HB and on the MCVs to get when the patient is microcytic anemia, macrocytic, monocytic anemia. Those one you should check on the full hemogram. And also you do peripheral smears. Peripheral smears, you study on the red blood cell, white blood cell, platelets, and also sorts. Then reticular sites of this red blood cell, and also iron studies indicators. You check on the blood volume of the ions. So those one are the investigations that you should do to a patient to identify if this patient is having this anemia. And also you should check on when these patients are on medication like the chemotherapies, that they reduces the HB levels, and also alcohol intoxication, smoking, those are abuse of drugs. You should also check on that. And studies, just take a good history, and maybe on treatment of these patients, you counsel on the life supports like eating of green vegetables, fruits, and also animal products, just to boost these patients, and also put them on iron, just to correct on the iron deficiency anemia. So you put them on that, and also deworming. You deworm for these ions that you deworm on the on the like worms that feed on these red blood cells to find anemia. So on our next study, we are going to teach you on how to interpret the full hemogram. So if you are watching this video for the first time, please share, like, share the link and subscribe. So let's see each other on part 2, interpretation of full hemogram.